My name is Sarah, and my colleague Jenna and I will be discussing European foulbrood disease. So the European in European foulbrood refers to the European honeybee, Apis mellifera. However, this disease has a worldwide distribution and is present on all continents, although it has not been reported in New Zealand, I believe, to date. This is a brief outline of my talk. We'll discuss the etiology, the history, gross findings, pathogenesis, histopathology, diagnosis, prognosis, and therapy and prevention of this disease, followed by a brief description of some of the research we are doing on European foulbrood. So the etiology in this case is a bacterium called Melissococcus plutonius. And this is a non-spore forming bacteria in contrast to Paenibacillus larvae, which causes American foulbrood. Similar to American foulbrood, European foulbrood is a disease of brood. However, unlike American foulbrood, European foulbrood is typically not fatal to the colony. Similar to American foulbrood, European foulbrood often results in a spotty or shotgun brood pattern, shown here where we have larvae of different ages in adjacent cells. The typical history with European foulbrood is occurrence in early spring, although it is reported during other times of the year, including the fall. However, its association with early spring is common here in Canada. In early spring, typically the bees within the colony will be winter bees, and they will be reaching the end of their lifespan. However, with the introduction of new pollen resources in the environment, this will stimulate the queen to begin laying eggs and to renew the population of brood within the colony. When the queen begins to lay eggs, there tends to be a lot of open brood. However, in early spring, there may be inadequate nursing bees available to take care of this brood as the winter bee population is declining within the colony. And so in early spring, we may end up with an imbalance between the amount of brood and the number of nursing bees. And this imbalance can result in inadequate brood care and nutrition of the developing brood within the colony, creating the perfect circumstances for European foulbrood to emerge. The gross findings of European foulbrood, as I mentioned, are often a spotty brood pattern, which may consist of larvae of inconsistent ages and brown or deflated larvae. In some cases, the larvae will be dead and occasionally form scale at the bottom of the brood cell. Shown here in this diagram, the early stages of European foulbrood will be characterized by a discolored larva, which may have prominent tracheae, and gradually the larva will become more discolored. It may twist or form a corkscrew shape, and ultimately the larva will die, resulting in a rubbery scale. So it's important to mention that European foulbrood is typically a disease of open brood affecting the colony's larva, and death typically occurs prior to capping and prior to pupation. Once the larva dies, there is potential invasion by other secondary bacteria that will result in decay of the larva. And some of these secondary bacterial invaders are listed here. This secondary bacterial invasion is responsible for the reported sour odor associated with this disease, hence the name Foulbroud. And the odor is reported to be similar to sauerkraut or sour milk. Secondary bacterial invasion can also result in a pseudo-ropiness, which may resemble the clinical signs of American Foulbrood, shown here. However, the difference with European Foulbrood is that when the larva is macerated and drawn out, the larval rope will be short and less than 2 centimeters in length, in contrast to American Foulbrood, where the rope will be greater than 2 centimeters typically. So now we'll cover the pathogenesis of European Foulbrood. This disease infects newly hatched larvae, and 100 or fewer bacteria are necessary to initiate infection. Infection typically occurs through the oral route when these newly hatched larvae are fed contaminated brood food that contain Melissococcus plutonius. The bacteria then go on to multiply within the midgut of the infected larva. And under conditions of colony stress, so for example, when the nursing bee population is inadequate to care and feed the colony's brood, under these conditions, the bacteria may outcompete the larva for food, resulting in starvation and larval death. Secondary bacteria will then overgrow in the decaying larva, and the colony will go on to remove the dead larva, effectively breaking the disease cycle by removing the bacteria from the colony, and the colony will then spontaneously recover. In contrast, if larval infection occurs when the colony is not under stress and has adequate nursing bees to feed and care for the colony's larva, the larva may in fact survive infection and emerge as a slightly smaller adult bee. However, the concern in this scenario is that the newly emerged adult bee will serve as a reservoir or carrier of the bacteria, and will be able to spread the bacteria when the bee defecates within the colony. These persistently infected bees are also able to spread the bacteria between colonies and between apiaries, although it's not known how long the adult bee will remain infected. So in this scenario, there will be no clinical disease apparent within the colony because the larvae are not dying. However, the bacteria may still be present within the colony, and although this bacteria is not a spore-forming bacteria, it is able to survive desiccation and can persist in equipment. As you'll learn later, we are able to reproduce European Foulbrood disease in the laboratory. And these pictures here show an example of our experimental infection. On top, we have a healthy control larva, and on the bottom, we have an age-matched infected larva, which has been experimentally inoculated with Melissococcus plutonius. On histology of these larvae, you can see the control larva has a midgut, which contains a moderate amount of ingesta. In contrast, the diseased larva contains a midgut full of gram-positive bacteria on this gram stain. If we look more closely at the midgut of this infected larva, you can see that there are a myriad of gram-positive cocci. representing an acute bacterial dysbiosis. In contrast to American foulbrood, European foulbrood does not result in septicemia, and the bacteria are not able to penetrate the midgut epithelium and remain confined to the midgut. To diagnose European foulbrood, one of the most commonly practiced laboratory techniques is bacterial culture. Infected larvae are swabbed and then plated on a selective media and incubated under anaerobic to microaerophilic conditions. And this selective media and specialized growth conditions will minimize the growth of non-target secondary bacteria. And in the case of a positive diagnosis, you will see shiny white bacterial colonies on the media. And on gram stain, these colonies will appear as gram-positive lanceolate cocci, which form short chains, confirming the diagnosis of Mosacoccus plutonius in this case, and European foulbrood. It is important for bacterial culture that live larvae be sampled, as they are most likely to yield a pure culture of Mosacoccus plutonius. And in this way, you can avoid the confusing array of secondary bacteria, which may contaminate dead larvae. As mentioned for American foulbrood, there are also hive-side immunology-based tests shown here, which may provide a rapid field diagnosis without the need for further laboratory testing, although in many cases it's advisable to pursue either laboratory culture or genetic methods of diagnosis such as PCR and sequencing. So at this point, I think it is good to review the differences between American and European foulbrood, because the prognosis of these two brood diseases is quite different. So American foulbrood is invariably fatal to the larva and ultimately to the colony, giving a very poor prognosis. In contrast, European foulbrood is typically a self-limiting disease, and colonies are able to spontaneously recover. For both American and European foulbrood, infection occurs during the larval stage. However, for American foulbrood, death typically occurs in the pupal stage after capping. With European foulbrood, death typically occurs before capping in the larval stage. And so European foulbrood is typically a disease confined to the open brood stage. With American foulbrood, one of the common gross clinical signs can be sunken, greasy, or perforated brood cappings. In contrast, as I mentioned, European foulbrood is typically a disease of open brood, and so the cells will not be capped, and abnormal cell cappings will not be a feature of European foulbrood. Both of these diseases can produce an odor. American foulbrood is typically a fishy or sulfurous odor, whereas European foulbrood is a more sour odor associated with those secondary bacterial invaders. The ropiness test is a diagnostic feature of American foulbrood, where a macerated, affected pupa will produce a larval, or will produce a rope which is in excess of 2 centimeters. In contrast with European foulbrood, the ropiness test may be negative, or a macerated larva will produce a short rope which is less than 2 centimeters in length. Both of these diseases can produce scale. However, the scales are different. So the scale with American foulbrood is typically on the lateral sides of the brood cell walls, and is difficult to remove. In contrast with European foulbrood, the scale is rubbery and C-shaped and will typically be on the bottom of the brood cell. In terms of economic impact of these diseases, there has been some recent work to estimate the cost per colony. And this cost is estimated based on the loss of income from pollination services and honey production of the colonies, as well as the labor costs associated with management and treatment of these diseases. So for American foulbrood, in Canadian dollars, the cost has been estimated to be approximately $656 per colony. For European foulbrood, the economic impact of this disease per colony is also quite high and has been estimated at $607 per colony. So you can imagine that as a commercial beekeeper, both of these diseases can have a significant effect on the beekeeper's bottom line. And so that's why therapy and prevention of European foulbrood is very important. So as I mentioned, European foulbrood can be a self-limiting disease and colonies can spontaneously recover. Beekeepers can help this process along by potentially providing capped brood to affected colonies to increase the supply of nursing bees to care for the brood. As well, there are various integrated pest management techniques that are practiced by beekeepers, including supplemental feeding during times of nutritional dearth to improve the colony's access to nutrition. As well, requeening may help the colony to have more hygienic bees, which remove infected brood. So if you remember, hygienic behavior is a genetically controlled trait, which can be selected for using the freeze-killed brood assay shown here. And so requeening a colony using a queen that comes from highly hygienic lineage may improve resistance to this disease. As well, regular replacement of brood frames every 3 to 5 years can minimize bacterial contamination of equipment. There are also some physical methods for treating European foulbrood, and one is isolating infected colonies in a hospital yard to prevent transmission of the bacteria to other surrounding colonies. Some beekeepers will choose to treat this disease by the shaking technique and shaking adult bees from affected brood frames into new equipment. And the remaining infected equipment can either be burned or disinfected using a bleach solution. In severe infections, some beekeepers will choose to burn colonies that have a high proportion of dead larvae. As well, in the United States and Canada, oxytetracycline is an antimicrobial option for treatment of European foulbrood. In contrast to American foulbrood, there's only one licensed antimicrobial license for use for treatment of EFB, which is oxytetracycline. And it is important, though, that beekeepers follow the label instructions for application of this antibiotic, often through powdered sugar, and that beekeepers observe the appropriate 6-week withdrawal time. So honey is not harvested from treated colonies for 6 weeks following treatment with oxytetracycline. So that summarizes the main features of European foulbrood disease. And so now my colleague Jenna Thebeau will continue by talking about some of the research our lab is doing on this brood disease.
All right, so hello everyone. So as Sarah mentioned, we don't tend to see symptoms of European foulbrood disease when there are abundant food resources available for the larvae. However, more recently, there has been an increased incidence of European foulbrood disease in blueberry pollinating colonies. And so for this reason, scientists are now wondering how blueberry production may be predisposing honeybee colonies to EFB. Canada is the world's second largest producer of blueberries, behind the United States, who is at number 1, of which honeybees contribute $235 million in value to Canadian blueberry crops each year. But despite this beneficial relationship between honeybees and blueberry production, the cause for this perceived increase in European foulbrood disease caused by M. plutoneus is largely unknown. So our current research focus is to try and determine the associated risk factors with blueberry production so we can mitigate these risks. To look at risk factors, we can look at the host pathogen environmental relationship, starting with the host. So here in Canada in the springtime, as Sarah had mentioned, when things start to warm up and the queen starts laying a bunch of eggs, this replaces the overwintering brood. During this time, there's a low number of nursing bees compared to the large number of larvae being produced. Nursing bees largely care for larvae by feeding them, and since larval mortality in EFB occurs when the pathogen outcompetes the larvae for food, it's hypothesized that we could see an increased incidence in European foulbrood disease in weaker colonies with less worker bees due to the inadequate food resources for these developing larvae. During the same time in the spring, this is also when blueberry pollination begins. And so colonies are primarily using blueberry pollen as a resource. Blueberry pollen is thought to have poor nutritional value and may be an inadequate food resource for developing larvae, predisposing them to this disease. To replicate and test this scenario in vivo, we took honeybee colonies containing a bottom super of honeybee brood and an upper experimental super. Brood frames for this experimental super were produced from a single caged queen, which was kept in the bottom chamber. Brood frames containing eggs were divided into quadrants and then replaced into the experimental chamber until eggs hatched into larvae, at which point the frames were again removed and each quadrant was inoculated with different concentrations of M. plutoneus bacterium. And then the frames were replaced back into these experimental colonies. After capping, these frames were brought back to the lab and monitored for survival in response to bacterial inoculation. Represented here is a visual example of what one of the control quadrants look like with healthy larvae and developing pupa, compared to the quadrant exposed to M. plutoneus, where there are many cells either containing small yellow deflated larvae or are empty because the worker bees had already removed them. When we used this in vivo technique to test the effects of blueberry pollen, or to test the effects that blueberry pollen had on the larval susceptibility of EFB, the upper experimental super was subdivided into two sections, one compartment containing blueberry pollen and the other containing a pollen derived from many different flowering species referred to as polyfloral pollen. And that frame of eggs that I was talking about previously, produced from this caged queen, was cut in half, and each half was placed in one of the compartments. So one was placed in the blueberry pollen and the other was placed with the polyfloral pollen. Frames were again divided into these quadrants and larvae were inoculated with different concentrations of M. plutoneus bacterium and then exposed to these pollen types. Overall, there was a significant lower survival correlated to blueberry pollen but only when the larvae were inoculated to high numbers of bacterium. So represented here is the mean % survival of these larvae, and these are just the different dosages of M. plutonius bacterium. While both blueberry and polyfloral compartments in this experiment had the same number of bees, the next goal for this experiment next summer will be to repeat this with a low number of nursing bees to see which scenario, if any, results in a lower survival as a result of increased susceptibility to EFB. Again, looking back at environmental factors, pesticides play a big role in blueberry production, and it's unknown if they are a potential risk factor. Several formulated fungicidal products are used in combination, and we hypothesized that this may decrease larval immunity, increasing their susceptibility to EFB. We're testing this hypothesis in vitro by selecting brood frames in colonies of newly hatched larvae, bringing them back to the lab, and then gently placing these one-day-old larvae into these 48 well plates using this grafting technique. And following an in vitro larval rearing protocol, we monitor these larvae in the lab over 6 days, so over their larval life. To test the effects of chronic formulated fungicide exposure on the larval susceptibility to EFB, we inoculated the honeybee larvae with M. plutonius, fed them a diet containing one or more fungicidal products over the course of the 6 days, and compared larval survival of this compared to control. And so this is a similar image, similar to what Sarah had shown previously, where EFB in the lab looks like a little larvae that is smaller, and this is at day 6, so smaller and yellow compared to a nice white plump control larvae. Currently, for the few fungicidal products we have tested, they do not increase larval mortality due to EFB compared to control. And finally, we're also looking at the pathogen itself, examining whether there are differences in strain virulence as well as pathogenicity of these isolates affecting blueberry pollinating versus non-blueberry pollinating colonies. We've been examining this by collecting culture swabs from clinically affected colonies with EFB involved in both blueberry and non-blueberry pollination. We culture them in vitro, and sending them for sequencing allows us to identify different strains, which can be categorized into non-virulent, somewhat virulent, and most virulent. We hypothesize that more virulent strains would be associated with blueberry pollinating colonies, although thus far we have not observed any correlations. We're then testing the pathogenicity of some of these isolates by infecting these newly hatched honeybee larvae with the different strains of M. plutonius, so from these culture swabs that we collected. And we hypothesize that isolates causing higher mortality in vitro would be correlated to blueberry pollinating colonies. So here's an example of what a pathogenic isolate might look like in vitro. So similar to the other example where you can see signs of EFB versus a non-pathogenic isolate, which might look just like control as it's not causing disease. And so far, we have not found any direct correlation between pathogenic isolates and blueberry pollinating colonies. So in conclusion, European foulbrood disease is often a self-limiting bacterial disease caused by the gram-positive bacterium Melissococcus plutonius. It's important to distinguish this disease from the more devastating American foulbrood disease. And upon diagnosis, it's important to culture live infected larvae to avoid contamination by secondary bacterial overgrowth. More recently, there's been an increased incidence in European foulbrood disease associated with blueberry pollinating colonies, which has been the main focus of our research. And our intended goal is to identify and mitigate the risk factors associated with blueberry pollination, so it no longer poses a health risk to this important pollinator. So hopefully one day we can confidently say that blueberry pollination no longer poses a health risk to honeybee colonies. And with that, I'd like to thank all of our sponsors, collaborators, as well as my lab mates and other contributors who have sent us some samples to help us with our work, as none of this research would be possible without them. And with that, we can take any questions. Doesn't matter. So I guess one of the questions is, can EFB and AFB infect brood at the same time? And certainly they can certainly have both bacteria affecting the hive at once. In the EFB gross finding slide, how long is the progression time from early EFB to rubbery scale? 24 hours, 48, longer? I guess it can depend on how many nursing bees there are as well. So it can happen over a couple days. However, typically the nursing bees will remove that larvae often before it gets to that point. Anything to add to that? No? Good. Do bees defecate in a colony? I thought they leave their nest to void themselves. Yeah, so they often do go outside of the hive to defecate. I'm not sure. What,
yeah, we're not sure the relation always.
Can you elaborate on the research of financials with respect to estimated the stated cost loss per hive relative to both EFB and AFB?
This research was done by Alberta Economic Department. So we quote from that document. If you email us, we can send to you this document. And just if you're wondering, by university, we are mandated to have masks if we are in close proximity. So that's why we have masks with Jenna now. Go ahead, next.
Regarding the liquid nitrogen hygienic test, how dependent on the colony pollination is the test? For example, does a stronger colony with more nursing bees test better, move more dead larvae than a similarly hygienic colony, a lower population?
Yes, that's actually an excellent question. And that's why, well, first of all, in one of my talks, you want to have your apiary and your hives standardized and be equal strength. Absolutely, it will be affecting. So it's not a bulletproof test, but you need to take everything in consideration.
How about more questions?
I think that was kind of what impact freezing expected claims that EFB or might. You might be able to answer these questions.
No impact on EFB, but on varroa mites, it should kill varroa mites.
And I guess we'll answer this last question, and we might be able to type responses in as well. Does EFB make a colony more weak or
Sarah?
Might?
Would you be able to speak up a bit? It's a little hard to hear you with the mask.
Yeah, sorry, it's probably because I'm wearing a mask. So does EFB make a colony more weak or susceptible to mites and viruses? And it certainly could, yeah, most likely. However, we're not really sure of this correlation to date.